Hospitals in England have had to suspend maternity and other urgent services because of a lack of staff, ITV News has learned. 16 trusts have told us that in the past 12 months, they've suffered a severe shortage of doctors and nurses, forcing them to take extreme measures.
As our health editor Rachel Younger reports, many hospitals are facing a daily battle to find enough staff.
It's a numbers game being played out in our hospitals. More patients means the NHS must find more staff, but when they can't, ITV News has uncovered the drastic action being taken when the doctors and nurses they have can't fill the gaps.
On the 18th, I did another long day.
Obstetrician Rina Agarwal does that regularly, working 13 out of the last 15 days. But some shifts are still badly understaffed.
I'd be in the middle of doing one thing and then I get called to do another thing and then I get called to do another thing. And I just, and you feel like you just feel very dissatisfied because you don't feel like you're giving anyone your full attention.
And when you have those shifts, are you operating right at the margins of patient safety?
Yeah, of course you are. Of course you are.
And without enough staff to cope, ITV News has discovered more hospitals are opting for the last resort. We asked every hospital in England if they'd suspended any acute services due to shortages of doctors and nurses in the past year. Of the 112 who responded, 16 said they had, on some occasions repeatedly. Among them, Airedale NHS Trust, which suspended maternity services 11 times in 12 months. East Cheshire, which suspended its maternity service twice and paediatric services 19 times. And the Princess Alexandra in Essex, where the stroke unit hasn't opened since April. It also includes Chorley Hospital, whose decision to downgrade its A&E has meant more patients at Preston, where Joy, who has cancer, waited for 5 hours.
I just wanted to die, to be quite
She asked me, am I dying, Mary? The ambulances were piling up outside, 4 or 5. They couldn't even get into the corridor because the corridor was absolutely packed with trolleys.
That's not many. How many beds?
No, because I've got 20 beds.
But even hospitals who have kept services open say it's getting increasingly tough to find enough staff.
It can take literally hours of our HR colleagues and our managers working together, working with the people that provide agency doctors and agency nurses, hours each day just trying to make these rotas safe.
No hospital wants to put its patients at risk. But if there aren't enough staff to go round, providing safe care is going to require some very tough decisions.
So what's the NHS said about those findings, Rachel?
Well, it's interesting, isn't it? Because during the junior doctors' dispute, we heard repeatedly, didn't we, from the Department of Health, that understaffing wasn't a problem. No such dismissal of all this today. In fact, they directed us towards NHS Improvement, who are responsible for regulating the hospitals. NHS Improvement said the safety of patients has to come first, and they told us that these hospitals are right to have taken the steps they have to ensure that patients are protected. As for the individual hospitals themselves, East Cheshire pointed out that although in their case some of these suspensions were repeated, they were on occasion a matter of hours only, so rather short. Airedale admitted this is far from ordeal, but said they had apologised to every single patient who had been affected there. But I think the important thing about this is that it's very difficult now for the Department of Health to continue dismissing these staff shortages. In fact, many chief executives I've spoken to said if they are not confronted, we are going to see more of these suspensions.
Rachel, thank you.